Do you want me to expand?
Right, so let's start. So welcome to the TRT and Hormone Optimization YouTube channel. And back with us as a guest is Dr. Angela Servis. So welcome back, Angela.
Thank you for having me back, Stephen. It's great to be here.
You're so welcome. So today we're doing some quick Q&A, a lot of questions in a short amount of time for all viewers looking for great answers and that don't have a lot of time to check all the long videos out. So what are the benefits of testosterone replacement therapy?
Good question. So there are significant positive impact on mood. So often and energy levels as well. Often when people come in, mood, brain fog, low energy levels, low libido, sometimes erectile dysfunction as well, and all of those symptoms can be helped when you get, within the right amount of time when you get onto testosterone replacement therapy if you've got a deficiency. Cardiovascular health can also be improved, and often people come with a real picture of metabolic syndrome, so reduced insulin sensitivity as well, and hopefully with a bit of improvement in body composition over time, those things can be helped as well.
Awesome. What are the risks of TRT?
So simply put, there are risks around the potential injection site reactions. Sometimes you can have, if you're not careful about how you're injecting as well, and some people are coming, this might be the first time they've ever had to do that, you can have just localized reactions. Sometimes you can develop infections or potentially abscesses if you're not absolutely scrupulous with your hygiene, which is really important. Sometimes people can have reactions to the carrier oils as well, so that's something to be mindful about. But the good thing is those are things that you can manage. Those are risks that you can manage as well. It can have an impact on fertility, and your clinician should always talk about that and talk about your fertility hopes for the future and for present time as well. And again, it's not something that means that TRT isn't for you by any means. It's something that you can that can support you over time, that you can sort of be aware of over time from the fertility point of view as well, and making sure that you're on the right treatment that works for you and for your needs and your family needs as well, or future family needs to come. There are also, we'll be talking a little bit about hair loss as well later on down the line, and that potentially for some people is something that can happen. But the benefits of being on TRT from a hair loss point of view are significantly outweigh the negatives for a lot of people for hair loss. So I often sort of do acknowledge it as a potential risk, but equally at the same time, actually the positives and the health positives, mood positives and things like that usually outweigh those. Testicular shrinkage as well is something that sometimes people get concerned about. And that can sometimes happen. It doesn't impact everybody. And, if it does happen, there are other things that can be done again to support you if that is an issue that really concerns you. HCG is sometimes used to help preserve testicular volume. So that's another potential there. But your clinician should be monitoring you for all of these things and making sure that you're aware of all of those things before sort of starting treatment as well.
All right. How many times per week will I have to inject?
Totally depends on you and your treatment. So there's a real range. Some people it might be daily because they're choosing to do it and it's right for them. Some people it might be 2 or 3 times a week. In the NHS, there are still practices where certain types of testosterone are being injected every 8 to 12 weeks. A lot of practitioners, it's not something that's usually using a long ester, sort of like testosterone undecanoate or libido. Usually people find better symptom relief, in my experience, with more frequent injections with potentially succinone or cypionate or enanthate, and they tend to be the ones that people get on better with. And there's a balance to be had between daily injections, which for some people is too much of a commitment and it interferes too much with their daily life. And I think there is a real balance to be had, and it needs to be a conversation between the patient and the clinician, finding out what the most appropriate thing is for them. And like I said, some people might start off on daily and then shift to 3 times a week, or, sort of what suits them.
Mm-hmm. Clear. What is the best TRT dose?
Oh my goodness, you see this all the time in forums, and there just isn't one. It very much depends on the person. And I find it really interesting how people sort of say, well, that's only X amount of milligrams, and, should I be on this? And it's like, you just told me you feel fantastic. You just told me your libido's good, your energy's good, your output at work's fantastic, your relationships are back on track. This is all fantastic. Let's actually maintain that trajectory. That's not to say that we don't need to increase at a point later on down the line, but often it's because people compare notes a bit online, which I think is really great. And I think there's a really lovely support network out there for some people. But it doesn't mean that Bob sitting next to you needs to be on the same dose as you, even though Bob's getting on very well too.
Sure. What if I don't want to inject? Are there any other valid options?
Yeah, absolutely. So actually, in the UK, we were quite far behind with regards to creams and compounded creams. However, now there are quite a few pharmacies that are offering creams, which usually are best with scrotal application because they're absorbed really well in that area. I think actually, Stephen, it was one of your videos that instructed people that it was you could use it before going to the gym. And actually, sometimes that sort of heating up and the sweating process actually improved the absorption of those creams. So creams are definitely an option. And like I said, the concentration of testosterone in the compounded creams is significantly higher than you might find in the licensed gels that you get. Although, gels are also an option, but maintaining a stable dose on the gels can be a little bit harder, and getting to a therapeutic dose just because of the quantities that are in there. But also they're suspended in an alcohol, which usually means that they can be quite transient in nature as soon as they've been absorbed into the skin. So that's something else to sort of be aware of. And the gels are not applied to the scrotum, just to be incredibly clear, because they're mostly based in an alcohol gel, so it wouldn't be comfortable to do so.
Mm-hmm. What's the best place to inject testosterone?
Okay, so it depends on the type of testosterone that you're having, and some people choose to do the subcutaneous. That means into the fat. Those injections people tend to do into the abdomen, and sort of you can pinch an inch, and then they go quite superficially into the fat. And a lot of people get on really well with those. If you're going into the muscle, it depends on you, depends on whether or not you've got somebody to help you with your injections. Some people are quite happy going into the glute, ventral glute, or some people will do their own deltoids as well. And like I said, if you're doing intramuscular injections, occasionally you've got people might have a partner or whatever that would be like to sort of come into clinic and be trained in giving that injection as well, which is also an option. But there are also plenty of videos available online now, which is great, offering all of that information.
Yeah. What's the best needle then to inject testosterone?
Yeah, so this is a really interesting question. So essentially, the different oils that the testosterone is suspended in have a different viscosity or thickness. So drawing up the testosterone can sometimes take quite a long time. So sometimes people try and take a 20 gauge or an 18 gauge, which are absolute harpoons. They're really, really big needles. And they pop them into this vial, which they're expecting to last maybe 4 months or sometimes 5 months or whatever. And in order to fill the syringe, and then they change it down to a smaller needle. Now, the problem with that is that sometimes you can get coring going on, which is where the needle takes a core of the bung in the top of the vial that goes in. And then that rubber then sits inside the oil, which doesn't sit terribly comfortably with me. But it also means that the top of the bung, by the time you've been using it for 4 months or whatever, is in a bit of a mess as well. So actually, if you can be patient, use a smaller gauge needle, maybe a 27 or whatever, to draw up. It does take time, particularly for enanthate, which is often suspended in one of the thicker oils. But I think it's quite worthwhile taking the time to do that. And actually, really, when you add it up into your day, it might take 5 minutes or something. It's frustrating, and it can be. But if you build it into your day as a bit of you time, stick on a YouTube video or whatever to watch while you do it, and it sort of makes the time pass a little bit quicker. But I would definitely recommend doing that over the larger bore needle. So sorry, Stephen.
Hmm.
To go back, about 27 to 30 gauge is quite reasonable to do that. Looking at needle length as well, that's the other thing. It totally depends on your body habitus and what percentage of fat you've got going on as well. But as you develop your technique for your injection, that should become more apparent to you. But it might change over time as well, depending on your body composition changing.
Hmm. Are SubQ injections as good as intramuscular injections?
It's interesting. So some people, make a change between one and the other, and I don't, I don't know. I've sort of read around the subject. I think that I haven't really found a conclusive answer to it. I think a lot of it goes into the fact that this is going to be a lifelong treatment for you. If you get to the stage where actually IM injections are really uncomfortable, then they're probably not for you. Again, it depends on the treatment. You certainly wouldn't want to be doing sustanon subcutaneously. That'd be an incredibly uncomfortable treatment to do. So you've got to find what works for you. As there are, I think there are certain schools of thought and certain clinicians who say there is an absolute and only way to take particular treatments, and they need, everybody needs to be on HCG or whatever. I don't necessarily think that's the way. I think if you find subcutaneous more comfortable and that works for you, then I don't really think that you're going to be missing out particularly on not having a medication IM. Or vice versa, really.
Mm, sure. After starting, when will I have to do my first blood check?
So I tend to do the first blood check unless there's been any significant symptoms or side effects around the 6 to 8 week point. And then we book in for a review shortly after that, just to see how things are going. That first appointment, I don't necessarily expect to see a whole load of change. And I think sometimes people are a bit frustrated about that. Sometimes you do. Sometimes people's worlds have really changed and life's got significantly better. And, some of their symptoms already being sort of starting to improve. And that's fantastic. There are some people that those symptoms might not start to improve sort of 4, 5, 6 months down the line. And I think for those people, sometimes it can be particularly disheartening because most of the people that talk about these things on forums have had the sort of the 2-week, woohoo, this is amazing. And they're feeling loads better, which actually, for people who it takes a little bit longer for, is really challenging. But I think, doing that quick safety check, see how things are going at the 6 to 8 week point, I think is really important. And then after that, we'll gauge it from there.
All right. What's the best moment to have blood drawn for control?
Yeah. So when you say for control, do you mean the first blood test that you have according to your medication, Stephen? Is that?
Yeah, you said after 6 to 8 weeks, but what moment in the week? Immediately after the injection, the day before the injection?
Yeah, of course. So if you're taking sustanon, for example, or cypionate, then I tend to take a trough measurement. So a trough measurement would be directly before you were going to have your medication. So for example, if you were going to take your medication Monday, Wednesday, Friday, then I would suggest taking it on the Monday morning if possible, so that we look at what the lowest level is before you take your medication. If you're on the creams, then I tend to do it the other way around and try and take a peak concentration, and that will depend on the preparation. So I'd have to communicate with the pharmacy that was compounding the medication.
All right. What's the best moment of the day to inject TRT?
So the majority of people that I work with find that first thing in the morning is best. And actually, I've had quite a few guys actually report sort of sleep disruption and restlessness when taking it at night. I don't know what your thoughts and feelings. I was interested in that question actually. What are your thoughts and feelings on that?
Yeah, I've heard several patients in the forums talking about that. In most cases, it doesn't matter. Some people think they will get anxiety if they inject late in the evening or
Yeah.
something. So if they're afraid of that, they just better inject in the morning. But I don't think there will be a big difference since there's such a long half-life anyway.
Yeah, exactly. The pharmacology of it doesn't quite make sense in my head. I think, even when people are putting on some of the creams and the tester gel actually like last thing at night, then maybe because it's a bit shorter acting. But I don't think it's not something, because there are some people often who will take the cream twice a day and don't really seem to have any impact. It doesn't really seem to have any impact. So I do wonder how much of that is actually a little bit psychosomatic, because actually you're not going to be experiencing. I mean, some people are sort of talking about doing it first thing in the morning to sort of emulate the peak that you would be getting naturally, but obviously because of the half-life, you're not necessarily going to be getting to that peak at that time anyway. So yeah, it's a tricky one.
Yeah, I think it doesn't really matter. So
Yeah.
what if my hematocrit is high? Do I have to donate blood?
No. Next. So no. So I think a lot of people watching your channel will be very much aware about the differences between elevated hematocrit from something like polycythemia vera, where actually we're looking at platelet dysfunction as opposed to hematocrit. So hematocrit can fluctuate anyway quite significantly. It will always be part of the process and part of the full blood panel that we pull out anyway. But donating blood, if you're going to do it anyway, then fantastic, good on you. There's a really great reason to do that. But high, it would depend on what your variant of high is, but it's not an immediate go off and go give blood, or certainly do venesection as well, which is the other thing a lot of guys come to me having done.
Yeah, sure. Most people don't ever have to donate blood. So do I have to take anything else on TRT? Vitamin D, DHEA, pregnenolone, magnesium, and so on. And if so, who will tell me what to take and how much?
So Dr. Google's phenomenal at selling you some supplements. However, I think, to be fair, for me, one of the things that I really advise people to do before they start reaching out to supplements, like if they've got a test done and they realize their vitamin D is low or whatever, or their magnesium's low, or they've seen some tests that have shown that actually that's not so great, then yeah, sure, you can supplement those things. But I think actually there's a hell of a lot to be said for cleaning up your diet, looking at your lifestyle, looking at your sleep hygiene, looking at your emotional and spiritual health. I know that sounds really woo, but actually, for me, when guys start out on TRT, I kind of treat it like, right, today's the beginning of the rest of your life. This is a time to be reflective, to think about, to goal set, to think about all the other areas of your life that you could improve, because potentially this could be a real marked line in the sand where you're going to be saying, hopefully your energy levels are going to be improving, your mood's going to be improving, your get up and go, your social connectiveness, and all of those good things are going to start improving. So actually, I would say, before you start thinking about any of that, start thinking about cleaning up your lifestyle if you can. What does your exercise profiles look like? Your diet, how much alcohol are you drinking? Are there any other drugs going on in the background there as well? And think about those things first.
Yeah, sure, 100%. What if my estrogen is high?
Okay, same. So estrogen on blood tests aren't necessarily particularly relevant. It depends whether or not you might be having symptoms. If you're coming in, I've had some people transfer from other clinics where they've had sky high doses, and actually, they have been developing, say, nipple sensitivity. They might be a bit watery, have a bit of water retention, high blood pressure and things. But that wouldn't necessarily, for me personally and my clinical practice, mean I'd be reaching for aromatase inhibitors or anything like that. But you're looking to optimize your treatment. And sometimes it isn't necessarily increasing your testosterone dose. It might be reducing it. And a hell of a lot of guys feel a hell of a lot better when you do bring it back down a little bit. Make sure that, that's actually looking after your whole health rather than just nudging the dose up.
Sure. More common questions. Is TRT bad for the heart?
No. Do you want me to expand? No, I'm joking. No, TRT actually has quite a cardioprotective benefits. TRT, when too much, when you take too much testosterone, we're not talking about TRT. It's, we're no longer replacing testosterone, so there's a whole different conversation. And yes, there can be some heart changes if you for years. For example, we're talking about somebody abusing steroids and very high doses for years, but actually, testosterone can be cardioprotective when done in the right way and done as a sort of a therapeutic replacement medical treatment.
Yeah. And most of that protective effect comes from the estrogen, right?
Yeah, well, it's fascinating, and I think estrogen gets this really bad rep, for being the thing that's actually going to have a negative impact on men's health. But it's really important for things like erectile function as well. But it's less known about and less talked about.
Mm. Will TRT increase the risk of prostate cancer?
Nope. Next. No. So testosterone replacement therapy won't increase your risk of prostate cancer. In fact, in some ways, it's been shown to be protective. And it will also mean that because you're being monitored regularly, it's often, if you were to develop prostate cancer, which a lot of men will do anyway at some point, it will be spotted earlier as well because you're being monitored and you'll be having those blood tests and you'll also be having the conversations. And actually, I think sometimes prostate cancer gets spotted pretty late anyway, because men, and this is one of the things I really bang on about, is that men don't necessarily have the same amount of touch points with their family physician or their doctor as women do. So, women are very much trained to go to the doctor about, menstrual cycles, contraception, having babies, not having babies, breast checks and cervix checks and things like that. Whereas men don't do that so much. So actually seeing regularly your TRT specialist can be really beneficial because it means they ask those questions and sort of those blood checks and everything will show whether or not there's any issues. But like I said, TRT can actually be protective for it.
Yeah, right. Will TRT make me go bald faster?
So it might do. So for certain people with a genetic predisposition, they might end up having prematurely sort of speeding up male pattern hair loss. However, I think one of the most important things to say is going back and saying, actually, would you rather the benefits of TRT and listing those, or actually, potentially, maybe not, but potentially accelerating your sort of program to male pattern hair loss. And I think that's one of the really important things to sort of weigh up in the scales, and actually having had the conversation with people beforehand, I think is really important. One of the things I also tend to do, if that is something people are concerned about, is have a conversation with them about finasteride, which I'm not a very big fan of, just with regards to the potential risks associated with finasteride and post-finasteride syndrome. So that's one of the things that I sort of front load people with. It's really patchy evidence about it, but I've seen a few patients that and I know that you're not supposed to look at a few specific patient outcomes and everything, and actually you should be looking to sort of bigger studies and everything, but it's hard not to let the individuals that I've spoken to impact my practice and impact the advice that I'm going to give to my patients when it has been so profoundly impactful on their lives in such a negative way. So yeah, I think that's an important conversation to have.
Sure. Will TRT solve my sex drive and erection problems?
Maybe. So I always talk about erectile function with regards to like a pyramid. So we've got hormones, we've got the head, and we've got vascular health. Hormones are really important. That's one part of our triangle. And so obviously we'll be trying to do what we can to improve that with regards to testosterone, and leaving our lovely estrogen alone, as long as it's not becoming problematic. But also thinking about the head, so what's going on with regards to stress levels, with regards to relationships, with regards to what's going on at work, how are you coping with life, and emotional and psychological fitness as well, which is all really important, and obviously nerves. The other side of it is also vascular health, which is super important, because obviously there's a component of erectile function that depends on vascular health, and I think that's a good area. It's being covered more and more by people taking things like daily tadalafil, which is in the same family as Viagra and is incredibly helpful for a lot of people. And sometimes it might take correction of hormonal imbalances as well as the vascular side. But again, if the psychological side of things aren't good, then that still needs working on. So it's not a wonder drug in that it's not going to fix everything. If one of those other things aren't quite a bit off kilter, then we need to make sure we fix those as well.
Sure. Last one, Angela. Will TRT help me lose fat and build muscle?
Only if you eat well, sleep well, and train, and also look after your mental health. So it's not a one-stop wonder. I always talk about TRT as being like a giant set of tools, really big set of tools, and you've got everything you need in there. However, if it's gathering dust in the back of your living room while you sit on the sofa, eating crisps and pizza and stuff, watching the TV, it's not going to do anything for you. And that again is really why I think reaching out for structures that are going to help facilitate your growth, and help you reach all your goals once you've decided what they are, I think is really important. Because actually, it ain't going to do the job for you. But the majority of guys, once they've got their timing right and their energy levels back and everything, find that motivation to get up and improve their body composition. So yes, the absolute potential is there, but you need to make sure that you're putting the work in as well. It's not going to do it for you.
Sure thing. So thank you so much, Angela, for answering all these questions. I'm sure this was very helpful for a lot of viewers. So remind people in the UK, how can they reach you? Where are you located?
Yeah, thank you for that. So I'm on the website, it's EdenClinicForMen.com, and I'm obviously also Eden Clinic for Men on Instagram. And they can go through the website and drop me an email through there. There's an email address at the bottom as well, menshealth@edenclinic.co.uk.
I'll put the link in the description of the video. Thank you so much.
Thanks, Stephen.
Give this video a like and visit the shop test store for your supplements, insulin syringes, disinfection alcohol pads, and 10 ml glass vials. Also check out my new ebook, Acne on TRT.